Wearing a mask is something that you're going to do to protect other people from inhaling the droplets that you express every time you cough, speak, or even just breathe. Masks like the one that I'm holding here are called a double ear loop for an obvious reason, or surgical masks, are probably your best bet in terms of something that's easy, relatively comfortable, and effective. Barring that, homemade masks such as this one, which are at least 2 thicknesses of cloth thick, are another great alternative. These masks can be made very inexpensively, they're relatively comfortable, and also reasonably effective. The controversy, I think, stems from people will say that the viral particles themselves are smaller than the holes in this mask, and that is true. And so no mask of this type is going to be 100% effective. But we are not talking just about viral particles. What we're talking about is respiratory droplets, and those droplets are actually a little bit larger than the holes in the weave of a mask like this. Wearing a mask like this functions much in the way you might cover your mouth when you cough. It's going to restrict those droplets from going as far as across the room if you were to cough or sneeze or simply just speak with someone. It's going to keep those droplets right here close to your person, and it'll help prevent you from contaminating surfaces or other people around you. For the mask to work, though, we all need to wear them. Okay, and so anytime you're in a setting where you have multiple people in a room, it's important that we all wear the masks. Those masks are going to help protect each other. And so, you see folks that don't want to wear a mask and they think, oh, I'm a tough guy, I don't have to wear a mask. But that's not really how that works. What you're really doing is you're putting others at risk because you don't want to wear a mask. I've been asked about the different types of masks. Here in the hospital setting, if we're working with a patient who has COVID-19, we're going to wear a mask like this, which is actually called an N95 respirator. These masks are designed specifically for medical personnel and help us when we're working in an airway of a patient who is known to be infected with this virus. During certain procedures, we may even wear a mask like this, which is called a P100 respirator. But these aren't really necessary for the average public. If you're in a school setting, you want to make sure that you're covering your face with something like one of these masks, either a homemade or a double ear loop, or you could even wear something like this face shield that's going to help prevent those droplets from traveling away from you if you cough or sneeze. I've been asked a lot about whether or not these masks are really effective. They are, and I can tell you that we know that because here at the hospital, our employees are not getting sick at the same rate that even the general public are getting sick. These masks are protecting our staff day in and day out, our visitors, our patients. We see a much lower transmission rate even at a hospital where obviously people with COVID-19 are brought by emergency services to receive care. We still see that these masks are extremely effective. If these masks did not work, I can tell you the hospital would be filled with sick people, and we are not. We've been able to effectively keep both employees and visitors safe by using masks just like this one. And so you can take it to the bank. We put our money where our mouth is. These are the masks that we rely on to stay safe, and you can too.